We have a young gentleman here. Your name is?
I'm Shawn.
Shawn. Okay, Shawn, tell me what has happened to your poor body.
Well, I occasionally get like unfounded depression or anger. I don't know.
Okay, unfounded depression.
Yeah, like
okay.
I don't really
Don't
see
know
a
what's coming
reason
from.
for it.
Got
Yeah.
it. Okay. And this has happened all your life or just started?
Around like last year, but I've noticed it more recently.
Okay, so about a year or so you started to develop this process. Okay, and up until the time you've been a happy-go-lucky guy?
Generally, yes.
Okay, let's get you up here and see what we can find. All right, come on back down here, and ooh, we got another one here. All right, so let's just show what I'm finding here. See if you can lift both legs without bending your knees. Okay, back down. And I want to put some pressure here. I'm doing this just to demonstrate that what I'm feeling up in here actually does in fact exist. Okay, try to lift your legs again. Ew, straining at the bit here. Okay, now let me do a little tension here. And try to lift your legs now. A little bit easier, huh?
Yep.
Okay, so that tells us again that we have a digestive system issue going on. In other words, the vagus nerve, the 10th cranial nerve, is being pinched by the neck right here, which is pinching, or I should say depleting the amount of energy going into the digestive system, which means we're going to have a problem getting enough material from the food you eat to repair your body. A lot of it is going to go to depress and suppress your immune system, because it takes a lot of energy to carry the trash out. Okay, so if you don't have enough energy to run the trash bucket, then it takes over, and you have not enough energy then to run the rest of your life. So let me try one little trick here. In your particular case, I'm going to pull towards me. Don't let me do it, okay? Hold tight. Okay, doesn't seem to be too much energy there whatsoever. That, by the way, that muscle we just tested is on the liver circuit. Now that means that there's another muscle right back up in here. Oh, wow. We got one, yeah. And that also is on the liver circuit. So I got to ask you a very personal question. Have you been taking drugs?
No.
No, not at all.
No.
Okay, you're not lying to me.
I'm not.
Okay, just checking. Because drugs will affect the liver negatively, and it will affect your emotions. The liver is associated with anger, resentment, and rage. Okay, and that's basically what you're feeling right now. You're going through some of these sensations. So there is an issue with the liver. Okay, so in addition, the muscle right there in back between the shoulder blades is a liver issue. Let me also find out, how about this in here? Is that tender in through there? That's also sore right in through there. And it's sore in through, right in through there?
Yes.
Yes, okay. So those are all liver dashboard gauges. Okay, so we know that the liver circuit in this particular body is having a hard time staying above the crowd, so to speak. All right, now let me also check to see what's happening here with the stomach. I want to push down. Don't let me do it. Hold tight. Okay, now hold this right here and hold up tight again. And we got the same problem going on here. Okay, so what we have is the stomach also being pinched. When this particular stomach is injured, it cannot produce the enzymes and acids necessary to process your food, which means it's going to overload the blood system, which is going to overload the liver, and the liver is going to start talking to you. Okay, so throughout the rest of your body, are you noticing any type of skin aberrations at all? I see some on your face. How about on your back, on your chest?
A little bit.
Okay, so I realize that most teenagers develop this type of skin condition There's a reason for it. And there's also a reason why it continues on into later life sometimes. I ran into the same problem myself. I had severe acne until I was probably about 26, until I finally discovered what was going on. And I changed it. And of course, I still have the scars, but I don't have the problem anymore. Anyway, when the stomach cannot process your food, suspend the rotting process, you're going to get rotting material coming down into the large intestine. That means that the rotting cesspool material is going to get sucked back up into the bloodstream. When that happens, your body has to do something. So the blood is going to the liver tries to pull out as much toxic material as it can. It's working overtime right now trying to do that. But then the body has an override switch. I mean, it has a safety valve. And there are two other ways for the toxic material to come out, either through the skin or through the lungs. So are you experiencing any type of asthma or type of lung problem at all whatsoever? Okay. So the rest of it then is coming out through the skin. But the greater bulk of it right now is going through the liver, which we are seeing right here. So something happened in your life about a year or two ago in your eating habits or in your behavior, something that happened that caused a major change in your digesting process. Can you relate to any of that at all?
I can't think of.
Can't think of anything that strange that happened. Were you involved in any physical activity at all? Like, did you get involved in sports, or where you're kicked around and moved around, or you're bending over a lot, lifting
nothing
things?
Changed. I do karate, but I did that before.
Okay.
I noticed this.
You did that before,
Yeah.
and now did you graduate to a higher belt and where you're getting punched more?
No. But I can
What I'm driving at here is something happened to further injure the stomach. And because of that, there was an event. There's something happened. We'll have to check the memory and see what's going on later. But something happened to this body somewhere along the line that is different from what it was in the past that caused an overload on the circuit, which is now overloading the liver, and the liver is responding by trying to come out through the emotions, trying to emit this stuff through the emotions, and that's what's causing your what do you call it? Anger and resentment and rage. That's where that's coming from. So, are you doing any kind of alcohol at all?
No.
Marijuana, anything like that?
No.
Nothing. Okay, just want to make sure, because the drugs will do that to you. So if it's not drugs, and it's not activity, something is happening in here that we need to pursue. So if we can't find obvious reasons why things are happening, we have to go deeper in. And this is what sometimes, I'm just going to give you an example, and not necessarily with this body, but I just want to show you that if we find, like with the questions that we're asking right here, and we get no, 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 then something is happening in here that we can't see. So then I would refer to Western medicine to use their observation techniques. They wanted a camera in someplace around to find out if there is something growing in here or something developing, something happened to this body to cause the stress on the liver. Okay? That is pretty much a definite situation right here. So we just have to find out what's causing it. And if we can't find it here, then we'll refer to somebody else who can look inside and find out what may be going on inside.
Okay.
Okay, so for sure there's something happening with the liver that's causing your emotional reactions. That's what's causing the pain here between your shoulder blades, all this stuff up through here. It's also going to get you up here in the temple area and up into this area, up and through here. And your knees may give you some difficulty right up and through here. Okay, now because of this, more than likely the large intestine is going to be overloaded again. You may develop farther down the line aches and pains right back up in here in your low back. You may also develop some pains down through here, which limits your leg motions. Those are things that you can expect. If you're not feeling them just yet, you can expect that to happen as this continues, as this situation gets worse. Okay, so we need to do something about it. And in these brief few minutes right here, we don't have the time to really get in depth to find out a lot of different things. So what I would feel more comfortable with is having somebody take a look to see if there's anything going on here that we can't see from the outside.
Okay.
Okay? All right.
Thank you.
Thank you, sir.